Welcome to another Medvarsity Deep Dive.
Well,
Today, we're going to be diving into the world of insulin regimes.
oh yeah.
Um, it's complicated stuff.
Yes, it can be.
For anybody who wants to know how insulin is used to manage high blood sugar, especially in critical care situations.
Right?
We'll even uncover the surprising fact that something as simple as mismatching syringes in insulin vials
Mm.
can really throw blood sugar levels out of whack.
Yeah, it's true. Insulin therapy, it's a bit of a high-stakes balancing act. There's a lot of factors to consider.
Absolutely. So let's start with the basics. We often hear about basal bolus and premix insulin regimes. What's the deal with those?
Okay,
Yeah.
so imagine you're trying to maintain a steady water level in a tank. Basal bolus is like having two taps. One providing a continuous slow drip of water, that's your basal insulin, to keep the level stable, and another that you can turn on and off as needed, that's your bolus insulin, to adjust for those sudden fluctuations.
Okay, so the bolus insulin is like responding to water level spikes. After
Yeah,
we eat,
exactly. Now, premix insulin, on the other hand, is like having a preset mixture of water flowing into the tank. It's convenient, predictable, but might not be ideal if you need to make frequent adjustments.
gotcha. So I'm guessing the choice between basal bolus and premix depends on the person's needs and lifestyle.
Absolutely. If someone has a fairly predictable routine and their blood sugar levels are relatively stable, a premix might work well. But for those who need more precise control, especially if their meals or activity levels vary a lot, basal bolus offers that flexibility. It's all about tailoring the approach to the individual.
Okay, so we have these two approaches, but we also have different types of insulin. I know there's basal, which is long-acting, and bolus, which is short-acting. What's the difference?
Okay, so think of basal insulin as a slow-release medication. It's like having a time-release capsule that steadily releases insulin throughout the day and night, preventing your blood sugar from rising too high between meals and overnight. This is particularly crucial in preventing something called dawn phenomenon, a natural surge in blood sugar that happens in the early morning hours. Oh, so
No.
it's like a built-in safeguard against those sneaky blood sugar spikes when you're not even eating.
Exactly.
Yeah.
Now, bolus insulin, that's your rapid response team. It kicks in quickly to address the immediate rise in blood sugar after a meal. Think of it as a quick injection of energy. That helps your cells absorb glucose from your bloodstream efficiently.
All right, that makes sense. Now, how do doctors determine the right dosage for each person? It
Yeah.
seems like it would be tricky to get the balance just right.
It is. It's a bit of an art and a science. There's a typical starting point, usually calculated based on body weight. We generally start with 0.5 to 0.7 units of insulin per kilogram of body weight per day. So for someone who weighs, say, 60 kilograms, that would be around 30 units per day.
Okay, so that's the initial ballpark, but I imagine there's a lot of fine-tuning involved.
Definitely. It's a dynamic process. Doctors monitor the patient's blood sugar levels
Yeah.
carefully and adjust the dosage based on those readings,
Yeah.
their diet, activity level,
Hmm.
and overall health. It's a constant dance of adjustment to find that sweet spot. It makes it sound almost like personalized medicine. Every individual needs a slightly different approach. Now, how does all of this apply? In critical care settings, I imagine things get even more complex. When someone is seriously ill,
You're absolutely right. In critical care, precise blood sugar control is crucial. For patients who can't take insulin orally, we often use intravenous insulin infusions. This involves delivering short-acting insulin directly into the bloodstream using a carefully calculated rate.
right, I've heard. There's a simple formula for calculating the infusion rate, something about dividing the blood glucose level by 100.
That's the basic formula. Yes, it provides a starting point. But it's not always that straightforward. We need to consider many factors, including the patient's insulin sensitivity, other medications they might be on, and their overall metabolic state. So it's not a five-fits-all calculation.
So even with a formula, it's more nuanced than it seems at first glance.
Exactly. Every individual responds to insulin differently. And in critical care situations, those nuances can have significant implications. Now let's move on to something that might seem incredibly basic, but believe me, it's a source of a lot of errors. Syringe and vial mismatches.
This is where the different insulin concentrations come into play.
You got it. Insulin comes in different concentrations, typically 40 units per milliliter or 100 units per milliliter. Each concentration requires a specific type of syringe. A red cap syringe for the 40-unit vials and an orange cap syringe for the 100-unit vial.
Okay, I see where this is going.
Unfortunately, these mismatches happen more often than you'd think. Imagine accidentally using a syringe designed for 40-unit insulin. With a 100-unit vial, you could end up injecting twice the intended dose. Conversely, using the wrong syringe the other way around could lead to dangerously low blood sugar.
Wow, it's incredible how such a seemingly small detail can have such significant consequences.
Absolutely. It highlights the importance of being vigilant, double-checking labels, and using the correct syringe every single time. It really does underscore the critical role of education and awareness when it comes to insulin therapy.
I'm curious, from your experience, what are some common misconceptions or questions that people have about insulin?
One common misconception is that starting insulin means your diabetes has gotten worse, or that it's a sign of failure. That's simply not true. Insulin is a tool, and sometimes
It's the best tool to help manage blood sugar effectively.
it's not a failure, it's just the right tool for the job.
Exactly. Another question I often get is, will I have to be on insulin forever? And again, the answer is not a simple yes or no. Some people may need insulin for a while to be able to manage with lifestyle changes or other medications. Others may need it long term. It really depends on the individual and how their body responds.
So it's all about finding the right approach for each person.
Yeah.
And being open to adjustments along the way. Absolutely. And speaking of adjustments, another important point to remember is that insulin requirements can fluctuate based on several factors.
It's interesting. What kinds of things can influence how much insulin someone needs?
Oh, a whole range of things. Stress, for example, can cause a surge in hormones like cortisol, which can raise blood sugar levels.
So even if you're diligently following your insulin regimen, a stressful event could throw things off balance.
Precisely. Illness is another big one. When you're sick, your body releases hormones to fight off infection, and those hormones can also impact blood sugar.
That makes me think about people with diabetes who get the flu or a cold. They probably need to be extra vigilant about their blood sugar levels during those times.
You're absolutely right. Even changes in physical activity can have a difference. If you're more active than usual, you might need less insulin because your muscles are using up more glucose.
So it's almost like your body becomes more efficient at using insulin. When you're exercising,
In a way, yes. And on the flip side, if you're less active than usual, you might need to adjust your insulin dosage accordingly.
wow. It's really a complex interplay of factors. It seems like the key takeaway here is that managing insulin is not a static, set it and forget it kind of thing.
You've hit the nail on the head. It requires ongoing monitoring, communication with your healthcare provider, and a willingness to adjust your approach as needed.
That makes perfect sense.
Yeah.
Now, for our listeners who are using insulin or might be starting soon, what's one crucial piece of advice you'd give them?
Don't be afraid to ask questions. Your healthcare provider is your best resource. Don't hesitate to ask about anything that's unclear or concerning. Ask about the different types of insulin, how to store and handle it properly, how to recognize signs of low or high blood sugar, and what to do in an emergency.
It's about being an active participant in your own healthcare journey.
Absolutely. The more you know
Yeah.
about your condition and how to manage it, the more empowered you'll feel, and the more effectively you can work with your healthcare team to achieve the best possible outcomes.
I think that's a powerful message to leave our listeners with.
I agree. Knowledge really is power when it comes to health. And with insulin therapy, understanding the nuances can make all the difference in living a healthy and fulfilling life.
So it sounds like the bottom line is open communication and a good understanding of how insulin works
Yeah.
are key to managing diabetes. In fact,
That's exactly right. And it's a tough, continuous learning process, even for healthcare professionals. The world of insulin therapy is constantly evolving with new research, technologies, and treatment approaches.
so where can our listeners go to stay up to date on the latest developments in insulin therapy? Are there any resources you'd recommend?
There are some great resources available. The American Diabetes Association website is an excellent place to start. They have a wealth of information on diabetes management, including insulin therapy, as well as updates on the latest research and guidelines.
That's a great tip. I also find that medical journals often publish articles on diabetes and insulin. They're written for a more general audience.
You're right. Many journals have sections dedicated to patient education or summaries of key research findings. Those can be very informative.
Well, I think we've covered a lot of ground today, from the basics of insulin regimes to the nuances of critical care and the importance of patient education. Hopefully, our listeners feel more informed and empowered to manage their health or support someone they know who is living with diabetes.
I hope so too. We've really tried to demystify insulin therapy and highlight the key takeaways. That can make a real difference in people's lives.
Absolutely. As we wrap up this deep dive, I want to leave our listeners with a thought-provoking question. Knowing what you now know about insulin, what questions would you ask your healthcare provider to ensure you're receiving the safest and most effective treatment?
That's a great question to ponder. It encourages everyone to be an active participant in their healthcare journey.
Exactly. Don't be shy about advocating for yourself and seeking clarification. It's your health, after all. A huge thank you to all of our listeners for joining us on another Medvarsity Deep Dive. We'll be back soon with more fascinating topics
from the world of medicine and healthcare. Until then, keep learning, keep exploring, and keep those brains buzzing.
And remember, knowledge is power, especially when it comes to your health.